Hi, Dr. Bela speaking, and I'm here with Brigitta, and we are going to do a treatment, a dermal filler treatment for her. And I would just like to ask you, what are we going to do today?
So,
what would you like to improve on your face?
So I sleep on my right hand side, so I can see this side is more flat than this side, so I like to a little bit to make it more even.
Mm-hmm.
And this is my weakness, so I would like
with the
to
jawline?
The jawline, yeah, improve the jawline area. And yeah, that's all.
Mm-hmm. But what kind of treatments you have had in the past?
So previously? I had fillers and Botox.
Mm-hmm. And where did you have filler treatment?
So filler treatment I had here, as I remember.
The cheek area?
Cheek area and
the chin?
The chin, here the jawline, but it was 1.5 years ago, so quite a long time ago.
And a little bit in the lips?
And a little bit in the lips, yeah.
Mm-hmm. Okay, so first let's clean the face, plan the treatment and do the treatment. Are you ready?
Yeah.
Good. And now I'm going to cleanse the face. This is a very, very important part of the treatment to prevent any possible infection. We also have to keep the hair out of the treatment area. So hairband is important. The next and most important part is planning the treatment. So for this I need to analyze the face, analyze Brigi's face and decide where I can see volume losses, because the most important point in aging that we lose from the superficial fat pads. So we lose from the cushioning of the skin, so that skin collapses and sags south. So everything coming to the mid part of the face and coming down. And with these filler treatments, we replenish the lost volume. So we project the face, we lift the face, we volumize the face. So when I make my treatment plan, I have to assess where I can see weaknesses, and I need to find the points where I need to build volume and projection. The treatment is based on individual analysis of the patient's face. So I'm looking for weaknesses and strengths, and I draw up my treatment plan accordingly. I need the patient seated because I need the gravity, so I can assess the face the best in this position. So I'm going to use two different strengths of filler. I use the Juvederm range, and I'm going to use Juvederm Voluma and Volift. I use the stronger Voluma at the cheek area and the chin area, and I use the softer Juvederm Volift onto the sides of the face and in the cheek area to the mid face. I start to work on the cheek with needles. Ready? Pinch the skin. Enter the skin quickly, there is no pain whatsoever. And then here I aspirate, I pull back the plunger and I check whether I'm outside the vessels, and there is a slow injection. All these make the treatment very, very safe. That's it, immediate result. Here I swap to cannulas, and for the cannulas I need a so-called pilot needle to make a tiny hole on the skin. And here I come with a cannula which is a long and blunt and flexible device. I love it, because from one entry point I can treat a relatively large area without any pain whatsoever. So I slowly enter into the skin beneath the muscles, and once I'm in position, I slowly deliver the filler injection. As you can see on the face, there is no pain at all. This is a completely painless procedure. So we have finished the treatments. I treated the cheeks, I treated the side of the face, and I treated the chin. And the last bit is the massage. With the massage, I just check whether everything is in place, everything is alright. This is a very gentle massage. If I need to even up something, I just do it. From the patient perspective, this is very, very important. Not to wear any makeup today, or at least 6 hours after the procedure. You are not allowed to touch the injection sites because you can cause injection site related infection. And you know, as you can see, there is no bruise whatsoever. A little bit of redness, so she can go out this evening without any visible signs of the treatment except the beautiful results. Maybe it's a little bit sore the next day because of the injections, but nothing more than that. Great, thank you.
Thank you so much.
Okay, so we have finished the treatment, and we treated the cheeks, the mid-cheek, and I treated this area to give a little bit pull and lift. I treated the chin, and I treated this side of the face to give a little bit of fullness. And whatever I do, I give projection, I give volume, and the more volume and the more projection I give, it gives to the lift to the face. So please move this way a little bit. This is straight after procedure, so this is what you can see, no bruise at all. Chin up a little bit. And again. Good. So overall, how would you rate the treatment discomfort-wise? So on the list of a scale from 1 to 10, overall?
2, between 2 and 3, really.
So that's really nothing. So the only thing that you can see is the needle prick, but nothing more than that.
Yeah.
And there is a numbing agent in the product, so it makes the whole treatment bearable. I don't say comfortable, but bearable. So
yeah.
2, 3 is very good.
Absolutely.
Yeah.
Yeah.
Okay. Are you happy, or what do you think?
Yeah, I love it. I
Okay.
can see the difference.
Yeah.
Yeah.
And the longevity of the treatment is 1.5 to 2 years. So it gives her a very nice time to enjoy the improved look. And we have put all together 3 syringes of dermal filler Juvederm, 1 syringe of Juvederm Voluma, and 2 syringes of Juvederm Volift.
Thank you.
Good.